Humanitarian activities for Rohingya community. The Rohingya people have faced decades of systematic discrimination, statelessness and targeted violence in Rakhine state of Myanmar under successive Myanmar governments and army. Since the 1970s, Rohingya refugees have been coming to Bangladesh from Myanmar to escape brutality. Thousands of Rohingya Muslims were killed, wounded or became homeless. Men and children were tortured and burned alive, and the women were indiscriminately raped. Finally, on August 2017, around 1 million Rohingya Muslims poured across the border from Myanmar into Bangladesh. They brought with them accounts of the unspeakable violence and brutality that had forced them to flee. According to a sense of prophetic learning as Ansar, we came forward to stand beside the Muslim Muhajir Rohingya brothers and sisters since the very beginning. In Cox's Bazar makeshift settlements, the Rohingya experiences lack of safe water, good sanitation system, education, as well as other basic needs, which in turn increased their vulnerability. We initiated several programs to support these most persecuted people. Orphan Support Program (OSP). We are trying to care for 2,401 Rohingya orphans in camps who grievously lost their father or both parents. Our mentors and teachers keep working relentlessly in order to support them and provide for their needs from accommodation to health care to education, food and clothes. We tried them grow up in their home without losing their culture. Education. Without adequate opportunities for learning, Rohingya children are more exposed to dangers of trafficking, child marriage, exploitation and abuse. Through 15 care home and learning centers, we are working to ensure access to learning for more than 3,000 Rohingya children aged from 4 to 14 years. 53 teachers along with supervisors teach them English, mathematics, Burmese, life skills and religious lessons. Besides, learning children are getting regular meal, educational equipment, toys, and hygiene pack. Women support. 52% Rohingya are women and girls who came from a helpless situation, faced ghastly experience. We work to ensure that Rohingya women and girls are safe, get psychosocial support, basic health consultations and emergency services, life-saving information, as well as skill building. About 300 women and girls are getting regular support from our 2 centers in the camp area. Ramadan support. Almost every Muslim keeps fast and does the religious activities with pure heart in Ramadan. But unfortunately, it is an unpreferable truth that most of the Rohingya cannot take their food, sehri and iftar properly while fasting for the financial insolvency. We provide more than 10,000 food packages to the Rohingya people every Ramadan. This package is sufficient for a 5-member family for 1 month. COVID-19 support, hygiene distribution. The COVID-19 pandemic has brought a new threat to these overcrowded conditions on marginalized Rohingya refugees. We help the community with masks, sanitizer, etc. and providing valuable information related to health and hygiene. We distributed 8,715 masks, 13,000 hand sanitizers, and 3,718 PPE. We also conduct 1,750 awareness campaign with festoons and publicity. Shelter. Rohingya refugees live in flimsy bamboo and tarpaulin shelters where the dangers of everyday life remain all too real. Moreover, landslides, flood, fire, etc. cause to damage shelters at different times. We have provided over 16,000 bamboo shelters including kitchen utensils, solar panel, sleeping mats, etc. household materials to the Rohingya families. Eid celebration. We have also come up with the special offerings to make the Eid festival a little more colorful to the Rohingya. We distributed 16,300 dresses, 18,700 food packs and 2,300 meal on these festive occasions. Kurban, Akika meat distribution. In recent years, we arranged 3,479 cows and 1,509 goats to sacrifice on Eid al-Azha for the Rohingyas. Each cattle distributed live to few families 2 or 3 days prior to the slaughtering event in order to make the Eid joyful for the children and other family members. The beef from each cow have been distributed among 35 families. As such, they got around 2 kg of meats each. We also provided beefs to Rohingyas donated as akika or sadaka whenever we receive from our distinguished donors. Winter support. We have completed distribution of blankets, shawls, sweater to Rohingya families in order to help the refugees keep warm during the harsh weather in winter. Our distribution so far as 26,700 shawl for male and female, 23,650 sweaters for both male and female, and 31,000 blankets. Health and nutrition. Refugees living in camps are often particularly susceptible to outbreaks to communicable disease due to high population densities, poor sanitation, and hygiene conditions. Major health problems prevailing among Rohingya refugees are unexplained fever, acute respiratory infection, and diarrhea. Non-communicable diseases like hypertension, diabetes, and their risk factors are also highly prevalent among these people. During this COVID-19 pandemic, we provide regular health support through 8 facilities in different camps. 5 health posts for outdoor treatment, consultation, 1 primary health center for 24/7 service for both outdoor and indoor, 2 mobile dental clinics for oral treatment, 1 diagnostic center for pathological tests, and a center especially for maternal and mental support. More than 1,000 patients visit these facilities every day and receiving treatment with free medicines. A skilled and experienced medical team consists with 12 physicians and 4 dental surgeons. WASH interventions in refugee camps aim to meet basic needs and improve safe access to water of sufficient quality and quantity, sanitation and hygiene practices. A WASH intervention helps to improve hygiene and health status and reduces morbidity and mortality in the refugee population. Last few years, we built 400 of 5 or 2 unit toilets, 450 unit bathrooms, 700 deep water tubewell, 250 unit semi-deep tubewell, and 300 shallow well, and 33 unit water networking with overhead tanks. Emergency response and relief. Rohingya families fled violence, but uncertainty about their future grieves those living in the world's largest refugee settlement. At the very beginning of Rohingya influx, our emergency relief team responded quickly to the Bangladesh-Myanmar border area and reached the distressed, traumatized people, giving life-saving food to children and families in crisis. We have already provided 98,000 family food pack comprises with rice, salt, potato, onion, mustard oil, chili powder, garlic, flour, ginger, noodles, dates, etc. 27,000 umbrellas have been distributed to ease movement during monsoon. On 22nd March 2021, a fire in Cox's Bazar caused widespread devastation when it quickly spread across 4 Rohingya refugee camps, displacing around 50,000 refugees. Approximately 9,000 families lost their shelters, belongings, and food. We worked to alleviate the situation so as to allow families and individuals to begin the slow process of returning their lives to normalcy. Fire victims get 62,300 cooked meals. 3,700 family got hygiene pack, dress pack, and floor mats. Medical teams rapidly provided necessary treatment to 28,627 injured with free medicines. Flood brought new misery for Rohingya refugees in July this year. Thousands of people have been made homeless by flooding after monsoon rains inundated refugee sites in Cox's Bazar. Our volunteers distributed 6,500 cooked meals and 1,480 food pack to displaced Rohingyas. Our efforts are significant, but more to do as the number of Rohingya people are huge. We are seeking your dua and kind support to continue such humanitarian programs in the upcoming days. May Allah accept our noble initiatives and hard works. Ameen.